Welcome back to the second of our MHA Healthcare Specialist videos. I'm Dave Walker, Senior Tax Manager, and again joined by Robin Holt, one of the Senior Financial Advisors from the Specialist team. We're going to look at today about some early part of planning from people that are going into either general practice, partnership, or even as locum GPs and clinicians within the secondary care sector as consultants.
So generally speaking, the key focus is, of course, first of all, to have a target. And whilst it might seem a little premature at the earlier part of your career, is also to have an understanding of when you want to perhaps finish it. Now, part of this is, of course, is to ensure that you maintain good records. Much as you would do for your medical patient notes, it's important, of course, that you have a clear identification of your current circumstances, what you have, and what you're likely to build up perhaps towards that end goal of retirement. And the way that I look at this, first of all, is to document, in effect, what assets that you've got, what liabilities you may well have, particularly because at this earlier stage of your career, chances are it will be a younger family scenario, or alternatively trying to advance to that marital and children stage. And naturally that adds in more risk and more responsibility for you to make sure that the plan actually does work. So what I would suggest in the first instance is good housekeeping rules. As I say, a good manifest, a docket of what you have, where it is, who's it with, and how much is there, and what kinds of returns you're getting. I would also suggest that you manifest what your spending habits are like. Because at this stage, the chances are is that lots of surplus income is not going to be freely available because you're starting to build yourself up with critical assets such as a family home. But what savings that you do have at this point in time are really, really useful, because when it comes to investing, potentially for the future, it's all about time in the market rather than timing the market. And the compound value of your investments, even on small savings on a regular basis, one, first of all, by understanding your outgoings, mortgage, gas, electric, water, council tax, etc., we can establish what flexibility you've got towards protecting those futures that you've designed, and also what surplus you may well have to help, of course, build up the necessary reserves in order to be able to pay for retirement. The other kinds of things that we would also look at is ensuring that your mortgage is well thought of rather than waiting until the actual policy comes to an end. And in current circumstances, as we find ourselves, we've gone from the Bank of England base rate, almost cheap money, up to something now which was very, very quickly ramped up. And we're finding now that this year there will be a significant number of borrowers that are coming out of their lower rate and paying 2, 3, 4 times the interest rate that they're paying currently. So the other key points I would also look at is, unlike your bank account savings or your investment savings, the statements, of course, are required to come to you on an annual basis. However, for an NHS total reward statement, first of all, you must register for that service. And secondly, much like your state pension, register again, both run by the UK government, it's important that you request an up-to-date statement each and every year to ensure, one, you're aware of what cumulative benefits that you're piling up towards retirement, and secondly, to have that knowledge and understanding of where there may well be gaps or inaccuracies inside your record, that you, in a timely fashion, refer that back to the specialist advisors that you work with. David?
And I think there's the side that where we come into it from a tax and business structure side is, as your career develops, then perhaps more opportunities lend themselves with private work, things like that. How we set those up as a business structure, self-employed, limited company, the use of family members as shareholders, mitigating to as larger extent as possible, especially with things like the corporation tax rate from the recent budget increasing quite significantly. So working with our IFA colleagues, we get the tax and the business side of things as tight as we possibly can. We get all the business records and the family protected as much as we can. And then it's a matter of working together on things like the pension records to make sure that you are getting the benefit that you are paying for. Okay, Rob?
Absolutely. I think the last adage that I would offer, I mean, the key focus that most healthcare professionals will confirm to their patients, that they cannot be managing their health if, of course, the patient doesn't monitor their health. And that's very similar with the financial side of your household assets, that you must, of course, keep on top and form good habits that can be repeatable in a fairly minimal way, inconveniencing you each year, but actually can offer huge long-term benefits of doing so.